Hello and welcome to Eyes on Research, the podcast that digests the latest scientific innovations in eye research using simple and understandable terms. I am your host, Thales Guimaraes, medical doctor and clinician scientist at Moorfields Eye Hospital. Hello, my friends, and welcome to another episode of your favorite science communication podcast focusing in the eyes and the vision. I hope the month has been off to a great start and that the week has been treating you well so far. I'm very excited for this one because it is the second episode of our new series, Eyes on Research Guide 2. And today we'll be talking about cataract surgery. So this is your Eyes on Research guide to cataract surgery. Now, first things first, what is cataract? Cataract is a clouding of the lens of the eye, which is typically clear like glass. And to put this into perspective, when light comes inside our eyes, it goes through the cornea, which has a dome-shaped structure, and passes through the pupils, right? Then reaching the lens. This lens is called crystalline lens, and it's where cataract develops. Now, the lens is extremely important because it focuses the beams of light in a single point in the retina. So in essence, it is necessary to have a lens to have a sharp vision. And we talk all about this in our evolution of the eyes episode, so go give it a listen and you'll understand why a lens is necessary for sharp vision. Now, although there are children who are born with cataracts or cataracts that can happen earlier in life due to other diseases, the vast majority of cataracts are related to age and expected to occur at some point in our lives. They develop very slowly with aging. That's because as we age, the lenses in our eyes become less flexible and thicker. And aging and other medical conditions can cause proteins and fibers within the lens to break down. This is what causes the cataracts. A cataract typically happens in both eyes, so it's bilateral. And what it does to the light is that it scatters it more and blocks it as it goes through the lens, right? So this essentially what this does is that this prevents a sharply defined image from reaching your retina. As a result of this, your vision then becomes blurry. However, there are some external things that can accelerate the speed of cataract development as well, such as, for instance, obesity, diabetes, smoking, ultraviolet radiation coming from the sun, which is one of the reasons why it's very important, for example, to wear sunglasses with UVA-B protection when outside. And we have other episodes about some of these things, one about smoking and its effects in the eyes, and another one about the damage that the sun can cause in our eyes. So go give it a listen if you'd like to dive a bit deeper in these topics. And we also have an episode coming soon about eye protection against the sun. We'll be talking all about sunglasses and other very cool things. So make sure you check this out. It's coming in a few weeks, and the schedule should be in a post in the link in the description. So go check it out so you can see what's coming up. Now, people who have cataracts, they see through cloudy lenses, and that's like looking through a fogged up window. Right? The first few symptoms of cataract include difficulty to read, fading or yellowing of colors. So, for example, a wall that you know it's white because it's your it's in your house, it's your wall, it becomes a little bit with a yellowish tinge. That may be a sign of cataract. And then sensitivity to light and halos around bright lights, like headlights from cars, which make it particularly challenging to drive a car at night. Now, for the sake of classifying cataracts, there are a few types of cataracts that one can have, and I don't want to lose you with the more technical and unnecessary detail, but suffice it to say that there are a few different types of cataracts, such as nuclear cataract, cortical cataract, but these will ultimately converge to a similar point, which is causing blurry vision, right? Remember that the lens is foggy. It's like a foggy glass. So now you know what cataract is, right? And what causes it. How do we treat cataracts? Well, most cataracts develop slowly and they don't really disturb our eyesight early on. At first, just using stronger lighting to do your daily tasks and prescribing new eyeglasses and changing it frequently can help deal with cataracts. But when impaired vision gradually affects usual activities, your activities of daily living, cataract surgery might eventually be needed. Fortunately, cataract surgery is generally a safe, effective procedure. In fact, it's one of the safest procedures one can get in any part of the body. And here's a great opportunity, I guess, to answer one of the most common questions that we get in eye clinics. The question is, I have a cataract already. Why not just do cataract surgery? My doctor told me that I need to wait for the cataract to be a bit bigger or more mature. And why is that? Well, indeed, we feel a bit more secure to proceed with the surgery if the cataract is impairing vision and affecting the quality of life and your activities of daily living, whichever these are. And the reason for this is because we need to be able to justify doing a surgery. It is a safe procedure, and again, it's one of the safest procedures that one can have in the body, but there are some potential complications that can occur. So eye doctors do this to protect a patient's best interest. It's not that we don't want to do surgery. Actually, it's rather the opposite. Eye surgeons love to do surgery. Sometimes we don't do in the patient's best interest. It is a balance, right? You have to weigh between risks and potential benefits. If the benefits do not justify the risk, as minimal as they are, if it doesn't justify the risks, no one will do your surgery, right? Now let's focus a bit on the specifics of the surgical treatment. Cataract surgery involves removing the lens that is otherwise clouded and replacing it with a clear artificial lens that we call an intraocular lens. It will remain permanently in your eyes, and we'll talk about these lenses really soon. Now, cataract surgery has historically been done unilateral, so one eye at a time, meaning that you have one eye in one day and maybe a few weeks after or a few months after or even days after you have on your second. But there are specific settings and surgeons that swear by doing surgery in both of your eyes in the same day. While this appear more convenient, right? Most surgeons to date only do unilateral surgery, so one eye at a time, as doing both eyes may make the procedure more prone to some issues, for example, infections and other unexpected events. You need to talk to your surgeon and come up with a plan with him directly. This is an option that's largely based on your own surgeon's experience and the complexity of the case as well. So of course, on a case by case scenario. Cataract surgery is typically done on an outpatient basis, or I think this is called in the US a day procedure, meaning that you will go to the hospital for surgery in the scheduled time and won't need to stay in a hospital after the surgery. You usually stay awake as well during the procedure, and the anesthesia is done topically with a medication to numb the eyes only, and with some sedation that can go through your veins if necessary. And again, historically, cataract surgery involved an injection to block the muscles in the eyes so that a patient would not move his eyes during the procedure. But now there is a recent trend, or should I say, a recent inclination to go towards minimal topical anesthesia with eye drops. And some services offer this. You need to discuss this with your doctor to see if he's comfortable with doing that. And if not, what is the option that you have? Now, I've been talking about safety and that there are some risks, although they are very small. Now, what are these risks exactly? Well, the first is risk of infection, right? And other complications like bleeding and retinal detachments, which is a pulling and a separation of the retina from its underlying tissue. Although this can cause permanent vision loss, these are very, very rare events. After the procedure, the main thing that happens is that your eyes are a little bit sore, right? Or a little bit swollen or a little bit red for a few days, with healing happening within a few weeks, sometimes days, right? If you need cataract surgery in both of your eyes, which is usually the case, your doctor will schedule surgery to remove the cataract in the second eye after you've healed from the first surgery. So now that we discussed what to expect, let's talk about the types of surgery. Because you may have access to an eye hospital, for example, that has a laser available for the procedure, right? And this is another of our patients' preferred questions. Can I have laser surgery, right? In essence, these days there are two main types of cataract surgeries with a few variations of these here and there relating to the surgical technique. The first one is phacoemulsification. I know that's quite the name. This method is the most commonly performed technique, and we also call this a small incision cataract surgery. So what that is that a small incision is made on the side of your cornea, which is this clear dome-shaped surface in the front section of our eyes that we have briefly discussed in the beginning of this episode. The cataract is then removed by a tiny probe that's inserted into the eye through this incision. And the way this happens is that this device that goes into your eyes emits ultrasound waves, and these break up the lens so that it can be removed by suction. It is very safe, and when this technique was developed, it thoroughly changed the outcomes of cataract surgery. The second surgical technique is called extracapsular surgery. This is a more invasive surgery with a larger incision or a larger cut on the side of your cornea, which allows the removal of the cloudy core or nucleus of the lens in one single piece. The rest of the lens is removed by suction. Now, this is a procedure that may be used in thicker, harder, and more advanced cataracts. Usually, surgeons will opt for the first surgical type, which is phacoemulsification, but in some cases, maybe it's a severely or a very advanced cataract, and then maybe doing a surgery like this would be on the benefit of the patient because it's safer to remove the cataract at once. But there is a third type of procedure that involves a laser, right? And the laser is named femtosecond laser. If I had to say what is the question that patients most commonly ask me is, can I have laser surgery? Now, just to clarify what the laser does, right? The way that the laser helps is that it does some parts of the procedure that the human surgeon would do. It is a computer guided laser that is programmed by the surgeon. And again, this device will only aid the surgeon in performing some of the steps involved in the removal of a cataract. So, for example, it does the cut for the surgeon, right? And it breaks the cataract into small pieces that the surgeon can come and remove. Now, the safety of this procedure is very much comparable with the phacoemulsification, with the technique that the human surgeon is doing. With the phacoemulsification actually being faster and much more cost effective. Now remember that we live in the days of artificial intelligence, in the days of computers are better than human, right? This kind of discourse. And I have nothing against that. What I would say is that these surgeons, they do thousands and thousands of cataract surgeries before they can reach a level of mastery, right? We're talking about multiple thousands of surgery. If you think that laser surgery is actually going to substitute your human surgeon, that's not how it works, right? The way it works is that the laser will do a part of the procedure, but the surgeon will still have to come inside your eyes, remove the fragments of the cataract that was just broken, and put the lens inside your eyes, right? So it just substitutes a part of this surgery. Moving on, if you have ever participated in a cataract surgery discussion with a doctor, you will have heard that there are several types of lenses that can be implanted in a patient's eyes. So what's all that about, right? Well, remember that we have discussed in the beginning of this episode that the lens focuses the light rays onto the retina. This is a phenomenon named refraction, which is literally defined by a change in direction of a wave passing from one medium to another, right, causing a change in the speed of the light rays, of the waves, and there's a specific refractive power, as we say, for this to occur adequately. So there's a total refractive power that our own lens has to have to converge the light to the retina so that it can focus in the correct place, right? In the retina. The reason I'm saying all of this is because we can actually calculate the optimal refractive power of the lens that is going to be inserted into your eyes so that we can reduce or remove altogether your need for glasses. This means that not only your clouded lens is removed for a clear lens, but we can also aim to have a refractive outcome, meaning remove your need to use glasses. How cool is that, right? And there are multiple ways that this can be done. Let's talk about the different types of lenses then. So, monofocal lenses are designed to provide the best possible vision for distance. This means that when you choose monofocal lens, your intraocular lens will be set for distance. Now, one of the things that people forget here is that this also means that you will require glasses for reading, right? And why is that, you ask? Well, when we remove your lens, you lose the capacity to accommodate, or in other words, to contract the eye musculature for near vision, for near tasks. Monofocal lenses have only one point of focus, which is usually set for distance. So you would require reading glasses, right, for near vision tasks after the surgery. Is there a solution for this? Yes, there is indeed, which is the second lens type. multifocal intraocular lenses. And these have a corrective zone into the lens, which works in a lot of ways like bifocal glasses, right? Allowing patients to see both near and far away objects. Some multifocal lenses also correct intermediate vision. Then there's also a third type of lens that are the toric lenses. Now these have an added correction for astigmatism, which is a type of refractive error that happens when there's in simple terms, asymmetries in the curvature of your cornea. Now, we talked all about this in a specific episode about refractive errors released last month, so go check it out if you're interested. But the toric lenses, they have pretty much a refractive outcome. The idea is to get your astigmatism as close as possible to zero, right? And then there are the more specialized lenses, like the extended depth of focus intraocular lenses, which have only one corrective zone that extends a little bit to cover both the intermediate and the distance vision. And then there are the accommodative lenses, right, which can also correct vision at all distances in similar fashion to the multifocal lens. And it uses the natural movements of the eye muscles to change its focus. And then there are the newer, right, light adjustable lenses, which are the only type of monofocal lens that can be customized after the surgery with a series of light treatment done in office. So we have moved, right, from using uniform lenses, right? Before, when it first started, we didn't use any lens, right? And then we started using monofocal lenses, and now we came to a stage where we actually think about what is the target refraction, what are we expecting you to use glasses or not after surgery, right? So we have evolved a lot, and technology keeps evolving, right? It's incredible. The conversation that you need to have with your family and your doctor is based on the budget and some considerations regarding lifestyles, right? Ultimately, that's your choice. But let's say that you have just a scenario that I'm thinking right now. So you have an office-based job and you work all day long in your computer. Or maybe you read a lot, right? And you would like to reduce your need of wearing glasses for reading, for example. This minor inconvenience can be sorted with multifocal lenses, right? And then you also need to consider the price. Can you afford these lenses? And the thing is, there are some countries with universal health care, and usually there are specific sets of lenses that are implanted in patients undergoing cataract surgery, so you may or may not have many options. And in countries where healthcare is private, right, like the United States, not all intraocular lenses will be covered by insurance. Some will be quite expensive, and we're talking about more than $1,000 for a single lens, for instance. So this is, another consideration to make. I think this is all that I wanted to say in today's episode. Cataract surgery is amongst the most common procedures done daily worldwide. It is very safe and with an extremely high degree of efficacy. There are some considerations that you will need to make, right? And some decisions that you need to take. And your doctor is going to be the one who is in the best position to advise what can and what cannot be done safely on your particular case. Thank you so much for listening to me today. I hope you found this episode useful and that you can extract something from it. If it adds something to you, no matter how small it is, I'm happy already. So it's happy days. You can find us on Eyes on Research on your favorite social media accounts. We are everywhere, so you can look for us. You'll also find a link in the description of this episode to our support website, which is what we're using to post our weekly newsletters. And thank you so much for our supporters. You are really helping me keep this dream alive. If you like our work, please consider giving the podcast a rating in whichever platform you were listening to this episode on. Thank you very, very much. Have a wonderful rest of the week, and I'll see you in the next episode. And as ever, my friends, keep your eyes on research. Bye bye.